Hello guys, this is Mujib once again, and today we are going to talk about uterine fibroids. Yeah? So this side's where I live, there is a woman who has been going to a gym for a long period of time. Like, she wanted to reduce her belly. Yeah? Like, you know, these days people want these slim bellies. Yeah? So she wanted to reduce her belly. Yeah? So she was going to a gym, like trying to reduce that stomach. Yeah? And like for a full year, she saw no difference. Like the belly refused to reduce. Yeah? So that person like we advised her like to go and check whether she had uterine fibroids. So she went to the hospital, they checked her, so she had some fibroids. So fibroids can lead to that big stomach, whereby someone has a big stomach. And you may think, some people, you may think that a person, say fibroid, can grow and become very big, and you may think that a person is pregnant. Like some cases, people might say that you're pregnant, yet you're not pregnant. Yeah. So today we are going to talk about those fibroids. Yeah. So what's a fibroid? First of all, a fibroid is a non-cancerous growth that develops in or on the walls of the uterus. A fibroid is a non-cancerous growth that develops in or on the walls of the uterus. So according to some statistics here, 70% to 80% of women get fibroids at some point in their lives. Yeah, 70 to 80% of women get fibroids at some point in their lives. So I'm not trying to scare you. So what are the causes of fibroids? So the exact cause of a fibroid is not known, but there is a risk factor. There are very many risk factors to fibroids. So the first one is hormones. Do you know that those hormones which you have, the estrogen and progesterone, they can be a factor to the growth of the fibroid? Yeah. So those hormones, they can stimulate the growth of a what? Of a fibroid. So the second one, we have genetics. Yeah, that one is also a cause of fibroid. The third one is family history. So when in your family you have someone who has ever had a fibroid, yeah, so that one can be a risk factor for you getting what? A fibroid. So the fourth one is age. Yeah, it affects women in reproductive years. Like, it doesn't mean that it affects those people who are old. Like, even a young girl, you can get a fibroid and you get a huge belly. Yeah. We also have vitamin D deficiency, also have stress and poor diet. When you don't eat well, you risk to getting a fibroid. So those are some other causes of what? Of a fibroid. So there are types of fibroids. Have submucosal fibroids, like these ones grow beneath the inner lining of the uterus. We have intramural fibroids, like these ones grow within the muscular wall of the uterus. We have subserosal fibroids, like these ones grow on the outer surface of the uterus, and they may become attached to the pelvic organs. Yeah. Okay. Those are the types of fibroids. So what are the symptoms that you can note that I might be having a fibroid? Or what can you see? Or if your friend tells you that he's having these things, what can you say that this person is, or I might be having a what? A fibroid. So the first one is heavy menstrual bleeding. When you have heavy menstrual bleeding, you might be having a fibroid. So the second one is pelvic pain and pressure. When you have that pelvic pain and pressure, you might be having a fibroid. So the third one is frequent urination. When you urinate a lot, you might be having a fibroid. So you also have constipation. When you have too much constipation, you have backache. We also have pain during intercourse, sexual intercourse. You might be having a fibroid. We also have infertility. Yeah, infertility. So when you're not able to conceive, we talked about it in one of our videos. Yeah. So we also have those. If you have that huge belly, it's also a sign that you might be having a fibroid. When you have a huge stomach, you have gone to the gym, it has refused to reduce, you might be having a fibroid. So let's go on what treatment of a fibroid. So treatment of fibroid, like, it depends on the severity. Yeah? So you have to go to the hospital, by the way. First of all, you have to go to the hospital. They diagnose the severity of the what? Of the fibroid. So the doctors can give you drugs that can reduce the size of the what? Of the fibroid, yeah? So if it is very severe, you can even go for surgery so that they can remove it totally. Yeah? So thank you very much. I think this is helpful. Like, this session has been helpful to you, like, so that you know about fibroids. So if you're in that category whereby you've gone to the gym and the stomach is not reducing, you've done all sorts of physical exercises, you can check out, you might be having some fibroids. So I remain Mujib. Please follow me up, repost my videos. Yeah, more to come. Stay safe.